Good day, everyone. I am Zara May Deliza, and today I will be assessing the vital signs of a patient. Vital signs refer to measurements obtained by health practitioners such as the temperature, pulse rate, blood pressure, respiratory rate, and oxygen saturation. As indicators of health status, this measurement indicates the effectiveness of circulatory, respiratory, neural, and endocrine body functions. These are quick and efficient way of monitoring client's condition or identifying problems and evaluating the client's response to intervention. These are also part of the database that a nurse collects during assessment. Before performing the procedure, you must first introduce yourself and verify the client's identity. Explain to the client what you are going to do and why is it necessary and how she or he can participate. This is to ease anxiety and gain their cooperation. Hello, ma'am. I am Zara May Deliza. I am the nurse assigned to you. May I know your name?
Karen Delize.
Thank you. I will be checking your body temperature, your oral and axillary temperature. Would that be okay?
Yes.
Perform hand hygiene and observe appropriate infection prevention procedures. Washing hands can minimize cross infections. Provide clients privacy by closing the door. Position the client appropriately. Apply a protective sheath to provide barrier to prevent transmission of organism. Place the thermometer tip under the tongue in the posterior sublingual pocket. Make sure that the client closes their lips around the thermometer to protect the thermometer from exposure to the air, which could alter the reading. For the axillary, pat the axilla if very moist. Apply a protective sheath to provide barrier to prevent transmission of organism. Place the tip of the thermometer in the center of the axilla, then position the client's upper arm down with the lower arm across the chest. Record temperature on a TPR sheet for basis for any nursing intervention. Write a nurse's note if there is a fever or any symptoms associated with fever per patient's record. Before performing the procedure, you must first introduce yourself and verify the client's identity. Explain to the client what you are going to do and why is it necessary and how she or he can participate. Hello, ma'am. I am Zara May Deliza, and I am the nurse assigned to you. May I know your name?
Karen Delize.
Thank you. Today I will be checking your pulse rate. Would that be okay with you?
Yes.
Perform hand hygiene and observe appropriate infection prevention procedures so that you can minimize cross-infection. Provide the client's privacy by closing the door. Select the pulse point. Since we will be assessing the radial pulse, the forearm can rest across the thigh with the palm of the hand facing downward or inward. Palpate and count the pulse. Avoid using the thumb because it has its own pulsation and may interfere with the accuracy of your count. Press lightly but firmly until you are able to feel the radial pulse. Count for a full 60 seconds. Note the rhythm and quality of the pulse. While the fingers are still in place of the client's radial pulse site over the chest, observe the client's respirations. Observe the respiratory rate and rhythm and depth. Count the number of breaths for 1 full minute. Since the client is in the sitting position, we will assess the apical pulse. Locate the apical impulse. Auscultate and count heartbeats. Use antiseptic wipes to clean the earpieces and the diaphragm of the stethoscope. Insert the earpieces of the stethoscope into your ears in the direction of the ear canals or slightly forward. Place the diaphragm of the stethoscope over the apical impulse and listen to the normal S1 and S2 heart sounds, which are heard as lub-dub. Count the apical pulse for 1 full minute. Assess the rhythm and the strength of the heartbeat. Document the pulse rate and rhythm in the client record. Also record pertinent related data such as variation in pulse rate compared to normal for the client. Before performing the procedure, you must first introduce yourself and verify the client's identity. Explain to the client what you are going to do and why is it necessary and how she or he can participate. Hello ma'am, I am Zara May Deliza and I am the nurse assigned to you. May I know your name?
Karen Delizo.
Thank you. Today I will be checking your blood pressure. Would that be okay with you?
Yes.
Perform hand hygiene and observe appropriate infection prevention procedures. Provide for client privacy. The client is at a sitting position and both her feet on the floor. The elbow is slightly flexed with the palm of the hand facing up and the arm supported at heart level. Expose the upper arm if the clothing is tight. Wrap the deflated cuff evenly around the upper arm and locate the brachial artery. If it's the client's initial examination, perform a preliminary palpatory determination of systolic pressure. Cleanse the earpieces with cotton balls with alcohol and insert the ear attachments of the stethoscope in your ears. Ensure that the stethoscope hangs freely from the ears to the diaphragm. Place the bell side of the amplifier of the stethoscope over the brachial pulse side. Place the stethoscope directly on the skin and not on the clothing over the side. Hold the diaphragm with a thumb and index finger. Pump up the cuff until the sphygmomanometer reads 30 mm of mercury above the point where the brachial pulse disappeared. Slowly release the valve on the cuff carefully. As the pressure falls, note the point of the manometer which you hear the first and the last sound. If it's the client initial examination, repeat the procedure on the client's other arm. Compare the blood pressure reading with previous readings and look for a corresponding change in pulse rate. For the documentation, record the blood pressure measurement in the vital sign monitoring sheet and report any significant changes in the blood pressure reading.